Hello everyone, it's me, your personal doctor. If you have not subscribed, don't forget to do so. Press the subscribe button, like, share, and comment. Today we are going to be talking about our breast health. Yes, babe of God, baba of God, mommy there, brothers, fathers, just grab your seat, sit down, let's discuss this breast matter. Yes, it concerns every one of us, right? Yeah, we all got our breasts, both the males and the females. And so today's discussion is not limited to females alone. Okay, so it's important. This October is WHO breast cancer month, so I like to create awareness for breast health. Talking about our breast, I know that a lot of ladies, a lot of us don't know how to self breast exam. Yes, it's very important that at some point in your monthly cycle you examine your breast to know if all is well, to know if there's any different, any new thing you will feel, anything that you will feel that wasn't there or that you had not felt previously, so that you can go to be checked. Okay, and then talking about being checked, it's not just only when you feel something you should get checked. As an adult, once in a while you can go for breast scan, right? Just go to the doctor, maybe tell them to also check, even though you have checked and perhaps you didn't feel anything. Once in a while, or it's part of checkup, your general checkup, just go to the doctor and get breast exam for routine checkup, right? Then if you are up to 40 years, it is also important, 40 years and above, that you check. Very important that you check once in a while. Once you have hit that 40 button, you know it, you form that champagne, it's for your 40 years old. Okay, just ensure you go and check your breast once every while. Okay, and it's also important you do a breast check investigation that we call mammography. Use mammography to check your breast once you are up to 40 years and above. And it's important that you keep that report after having the investigation. Give it to your doctor. If all is well, keep the report. The next time you're checking in another 1 or 2 years time, you're going to make reference to the previous report, right? Okay, so we have established the fact that it is important for everyone to know about their breast health, both males and females, and it's also important for us to self breast exam. For the males, you check at any time, but maybe you do it like once a while, once in 3 months, once in 6 months. For the females, because we have cycles, menstrual patterns and the rest, you check immediately after your period. Let's say 3 to 5 days after your period, you check. Okay, at a consistent time. So it's not like you check this month just before your period, the next time you are checking during your period, the next time you are checking 2 weeks after your period, the next time you are checking 3 weeks. No, the consistent and the most appropriate time to self breast exam is few days after your period. Let's say your period ended today. You can always decide that, okay, between day 3 and 5 after my period, every cycle I check, and that's the best time to do your self breast exam, because at that time all the engorged tissue has returned to normal, and then you take the appropriate position, with which I will show you with an illustration of a client to do that, and you use it to learn the proper way to self breast exam. Okay, so it's very important. Don't forget, we are celebrating Breast Awareness Month in October, so you take out this opportunity to self breast exam. Just watch this video, see the demonstrations, teach your children, show your children, learn it. It's very easy for both males and females. If you pick up anything you don't understand, or you feel anything you don't understand while you're checking, go to the doctors. Okay, you can either have an ultrasound scan of the breast, or if appropriate, you have a mammography. Okay, all right, so we have talked about how to self breast exam, and my client here is going to demonstrate what she had learned from personal doctor, how to self breast exam. Please don't forget to subscribe, like, share, and comment for free health tips. All right, so let's say you want to examine your breast, and I said for the ladies, remember, it's appropriate to examine your breast about 3 days after your menses. So make that a routine every month, 3 days after your menses. Okay, then if you are okay, like some persons who ask, what about women, postmenopausal women, when should they check your breast? If you are in menopause already, pick a particular day in every month. Like for instance, if you say 1st of every month I'll self breast exam, beautiful, so that you don't forget and make it a routine. Then for the brothers, for the men, for our daddies and uncles, just also pick any day and self breast exam. But for our ladies, it's very appropriate, because that's when your breast tissue best to be examined. Okay, all the engorginess and all that comes from cycle and period would have gone down. Okay, right? So now my instructor is going to show you how to self breast exam, what she had learned from personal doctor. So let's say we are starting from her right breast. Okay, so she's going to put her hand, so you put your hand behind your head, you put your palm behind your head. Okay, so this is to expose adequately your breast tissues for proper examination. Then you're going to use your left hand to examine your breast. You will do it systematically without lifting your hand out of your breast at any point. Okay, so you start from one point, you go around, you use the pop of your fingers, this part, at the pop of your fingers, right? So you're going to use it while your right hand is behind your head. The aim is to examine your right breast. So you use the pop of your fingers, you go around like this, go around like this systematically. You're feeling for your breast tissue. You're feeling, is there anything there? Is there anything abnormal? Is there any abnormal lumpiness? Is there any abnormal hardiness? Just go around your breast like that. Then you wrap up with your nipples, all right? Your nipple area, you go around it, There's nothing there, you're not feeling anything. And even if you are, just remember that what the next step to take is to go and see your doctor, okay? Then don't forget the axillary tail of your breast, just under your arm here, is very important. It's also part of your breast, and sometimes pathologies and then some conditions could start from this side. So as you're examining your breast, also extend it to the axillary tail of your breast. And at the time you're done with this, she's done with her right breast, okay, there's no lumpiness, without skipping any part, you just go around it systematically. You end up with the nipple. After the nipple area, you end up with the region of the axillary tail, right? Okay, you're through with the right breast. She's going to put her hand behind her head again for the left. Then you bring down your right hand. Then the right hand is going to examine the left breast now. Okay, in the same way, you're going to go systematically around your breast and feel with the pop of your fingers and feel your breast for any possible any lumpiness that shouldn't be there, or maybe it's normal but you're not sure. At the time you feel, you now know what you have there, and perhaps the reason for a checkup, right? Okay, so you go around and you wrap it up with your nipple area. Then don't also forget the axillary tail of the breast. So you go under your arm and check as well. Okay, yes, she has done us well. She has shown us how to self breast exam.